Hey everybody, this is Sarah saying hi from Richmond. Today, let's talk a little bit about what serotonin syndrome is, what to look for, and let's see what we can do about it when we think it might be happening. Well, serotonin syndrome is caused by too much serotonin. Serotonin is actually a neurotransmitter, and it helps regulate a lot of different functions in our body as well as how we feel. So if you are going to have too much serotonin, it is something that typically is caused because of taking too many medications or drugs that influence your serotonin level. It's usually an emergency and it's usually an accident. People don't end up with serotonin syndrome on purpose. Serotonin syndrome will look like extreme restlessness, extreme anxiety, trouble thinking straight. You might, this person is not going to be telling you, oh yeah, I'm not so sure I feel so well. You're going to know that they don't feel well. Having a very rapid heart rate, a fit, healthy person sitting still should really never have a heart rate over 80. So a fit, healthy person who's young and they have a heart rate 95 and above, that's going to worry you. You can see heart rates well in excess of 100. You will sometimes see shivering or sweating, chills and tremors. The person may complain of feeling stiff. You may see hand tremoring or rigidity. And then lastly, you tend to see a change in body temperature. And unlike a fever where, you're feeling under the weather and your temperature gets up to 99, 100, 101, this temperature can just keep going up to the point where people have seizures and brain damage. There have been records of people having temperatures of 107. So if you're seeing someone who's agitated, confused, their heart rate's up, they're sweating or shivering, they're moving in a strange manner, and they have a temperature, you are not going to miss the fact that this person is quite ill. Serotonin syndrome is typically caused by mood stabilizers, antidepressants, and drugs like tramadol. All of those drugs increase how serotonin is shuffled around in someone's brain. There are other substances. I'm thinking of cocaine, MDMA, aka ecstasy, amphetamines, and kratom. These are all substances that, when you suddenly start taking them, especially when you're already taking a mood stabilizer or an antidepressant, can cause serotonin syndrome by rapidly changing the level of serotonin in the brain. It is seen in the elderly because obviously they don't break down drugs and excrete them as quickly as younger people do. But you will see it also in people who are abusing substances or have a mental health problem because maybe they lose track of, I already took my pills today, it was a rough day, they're like, oh gosh, I need to take them again, and they sort of get out of sync. And this is not something that someone with ordinary, ADHD inattentiveness is going to struggle with. This is someone who's really having a bigger problem than that. It is really quite rare to meet someone who is stable and doing well have this problem because they're accidentally taking too much medicine. Kratom overdose is something that is kind of adjacent to serotonin syndrome because if someone's taking too much kratom, they can have the symptoms of both opioid overdose and serotonin syndrome. So the opioid overdose, you probably know, you can use Narcan to reverse that. However, serotonin syndrome does not have a nifty little pin where you can put it on someone's skin and inject some medicine and make the problem better. Serotonin syndrome is a medical emergency and that person needs to be treated by a professional team. So if you are caring for someone or you love someone and they're irritable, unable to sleep, they may be nauseous and vomiting, they may have developed shaking tremors, they have elevated heart rate and temperature, you want to think about serotonin syndrome and get professional help ASAP. This person, your patient, I'm using quotes here, may be so sick and grumpy that they will just not go to the hospital with you. So don't be afraid to call 911 if you need help. Serotonin syndrome is not something you should ride out at home. You really do need the support of the emergency team to get through this crisis. Once you sort of have that person's immediate safety assured, one of the things that can help is to get a very clear picture of what has been taken by that individual in the past 36 to 72 hours. Which drugs, which prescriptions, what street drugs they've taken may help save someone's life. So when it comes to serotonin syndrome, the treatment in the hospital that they're going to give this person that you care for is primarily supportive. They're going to try to cool an overheating body. They're going to try to prevent seizures that are caused by too much serotonin. They're going to do things that are supportive because we don't have a way to reverse the serotonin level in the brain. The best way to prevent serotonin syndrome is carefulness. Pharmacists, physicians, we have tools at our disposal in modern medicine. In modern medicine, we have tools that check for dangerous interactions. Usually people on one or two mood stabilizers or antidepressants are not going to come down with serotonin syndrome. But when people are on 3, 4, 5 psych meds, and then they have a bad day, so they're reaching for kratom or cocaine or something like that to help those bad feelings go away, that's a setup for a big problem. And when it happens because of prescribed medications, it's usually because the person or the caregiver or the prescriber doesn't know about all the drugs this person's taking. So maybe the patient's like, oh yeah, I take 1 and 2, but I don't take those other drugs anymore. That was my old doctor, I don't take them anymore. Well, in reality, in their pill planner, they may think they're not taking them, but maybe in their pill planner, they're still there. So the prescriber gives them another drug for their mood disorder, and then unfortunately, after a day or two, we trip them off into serotonin syndrome. So serotonin syndrome is easier to prevent than it is to treat. But in the situation that it does happen, the first thing that's going to happen is we're going to support the person's health, we're going to get them through the emergency, and we are going to stop the medications that are causing this problem. And with serotonin syndrome, early recognition and early treatment is key to making that full recovery that we want everyone to make. So I like to say that feeling so many times when you hear about an emergency, I know that hindsight is 20/20, but I would never want you to feel like your instincts and observations should be discounted. If you know someone well and they are not behaving like themselves and you are very concerned, your instincts and observations matter and they can save a life. So please don't ever be afraid to speak up. You really do matter. So if you have any questions, we're here. Drop us a line or give us a shout. Again, this is Sarah Bragson, nurse practitioner. I wish you a very blessed day. And if you have any questions or concerns, let us know and we'll send you some more information. Take care. Bye.